If you are trying to fill out an evaluation on a student, you will simply go down to the clinical evaluations portion of the menu and simply click Add Daily Evaluation. Here's the clinical evaluations, and we're just going to click Add. From here, you will simply fill out all of the drop-down boxes and then answer the questions provided about the student on an individual basis. So from this menu, you will just click Add a Student. Whichever student that you are trying to evaluate, you'll select your clinical site. Here's where your name will show up. If you have a dedicated username and password, your name will appear right here. If not, whichever hospital generic login that you've used will show up there. Make sure and add your clinical site. Here we're logged into White River, and your patient care area, whether it's adult floor, emergency room, ICU, and then the date that you saw the student. So if you need to backdate this, make sure and change it. You can use the calendar function here. Just click that, make sure the right date comes up. Then you'll just answer each one of these questions, 5 being exceptional, 1 being unacceptable, 3 is average. So answer these about each one of these questions about the student. Then if you have used your generic username and password for that site, we ask that you please put your name in here so that when we go back and look at these, we'll be able to tell who's filling out their evaluations. Okay? Once that's completed and you've filled in all of the questions, you'll just come down here and click Add Daily Evaluation. You can see that if you have forgotten to answer any of these questions, they're going to appear in red. They are required to answer every question, so it's going to prompt you to go back and fill those out. Once you've done that, you'll just hit Add Daily Evaluation, and then you'll be done. These daily evaluations are to be completed only on a weekly basis unless otherwise necessary. Things to remember when filling out this form are it needs to be done by the direct observer, and please provide as much feedback as possible as this allows us to correct any issues along the way. Also, please try and fill them out as close to the time of the observation as possible, as this allows for the most accurate feedback.